All right. Good afternoon, everyone. Welcome to our Ask the Expert today.
We are so excited for Clearing the Confusion with Natalie Ledesma, talking about supplements and your top questions. But of course, we always begin all of our education series with just a reminder about our sponsors because our virtual education events would not be possible without them. UFH Connect is presented by West, Merck, Lilly, Novartis, and Gilead Sciences with support from gold sponsors Pfizer, GSK, and Daiichi Sankyo, and our supporting sponsors AbbVie, TerraSera Therapeutics, and Verastem Oncology. So we are so grateful to all of our sponsors for bringing forward all of these wonderful education segments and wonderful speakers. We have a lot to get into today, so I want to roll right into housekeeping. Just to give everybody some general reminders, this is our September Ask the Experts. It will be with myself and my colleague Erin, and we are streaming live on Facebook. So this will also be recorded for our Her Library. Everybody who is watching, feel free to kind of join in, tune into the conversation with your questions as well. We're going to try to get through as many as we can. We definitely already have a lot to work from, which is great. And I just want to remind everyone too that tonight we actually have a speaker series at 6 p.m. Eastern Time, which is Cardio, Respiratory Fitness, and Cancer with Nikki Greismer. You can register at uniteforher.org/UFH Connect.
Wonderful. And we are so excited for all of our events. So if you want to come back and re-listen to our segment or listen to what we've covered already, by all means, join our UFH Connect video library. All of that is there. But like Aubrey said, we've already received so many questions in advance from our community. We know this topic is buzzing in the Unite for Her community. And I recently listened to Natalie speak on this topic at a talk earlier this year, and I thought I have to bring her to Unite for Her because she truly is incredible and such an expert in this space. And we know that our team is often conversating about supplements with our Unite for Her community, but I thought let's get into the nitty gritty with an expert in this field. So we are so enthused to have a fellow registered dietitian joining us today. So let me introduce our expert for this afternoon. With more than 27 years of experience as a registered dietitian nutritionist, Natalie is a well-seasoned practitioner, a board-certified specialist in oncology nutrition. Natalie is the founding dietitian of the nutrition program at the University of California, San Francisco Helen Diller Family Comprehensive Cancer Center. She's also a clinical nutrition specialist at Smith Integrative Oncology in San Francisco. Every day, she works with patients through her integrative and functional nutrition private practice. Natalie serves as a consultant and speaker for Digestive Care Inc. and Kate Farms. She's a member of the Lilly Lecture Bureau faculty and regularly presents to healthcare practitioners on nutritional counseling in oncology care. She is a certified LEAP therapist who helps manage adverse food reactions with an emphasis on food sensitivities. She provides nutrition counseling and frequently presents nationally on various cancer and integrative health topics focused around nutrition. She has taught college courses and cooking classes, has been extensively involved in community outreach, and today she is hanging out with our Unite for Her community to dive into supplements. So, Natalie, thank you so much for being here with us.
Thank you for the invite. Much appreciated and happy to be with everyone here that's on.
Wonderful, wonderful. So, I thought regarding this conversation to jump right in, we're often posing to the Unite for Her community, send us your questions. And we got a really great comment, uh, a general comment about supplements in cancer care. And I thought that this was a great place to start for our conversation this afternoon. So, this individual said, I thought cancer patients do better with getting vitamins, et cetera, through food rather than pills. And we had some additional comments just about, what supplements should I be taking? What can prevent my cancer? If I have a particular type of cancer, what supplements do I need to take? So, what do you say when you're working with patients when, there's this sense of I need to take, or I have to take, or I should be taking supplements in general?
So first and foremost, I would say that yes, I do want food to be the foundation of our nutritional, plan. The reality, unfortunately, is that we generally are going to fall short in certain areas and or that our environment isn't allowing us to really utilize, the nutrients that are there, or we may have digestive absorptive related components or genomic issues, or our treatment plans could be modifying how we are being able to, utilize different nutrients. So yes, indeed, we want food as that foundation, and we want to use supplements truly like as a supplemental source, not as a replacement. Um, and then I think also in terms of supplements, I do certainly use supplements on a daily basis with patients. I try to not have patients have a suitcase full of supplements, but try to keep it to more of a, decent allotment. And that varies for each person. That may be one for some, it may be five for some, it may be that others are, at that 10, but I try to not have it be, 100. And those that have 100, I normally am trying to pare that down somewhat to make sure we're not duplicating things. And then also, of course, our big overarching component is it safe, right? And
Yeah.
so we certainly want to make sure that whatever we're using and whatever one would be recommending, would be safe. And that always is going to be, kind of right at the top. And then I'm also thinking, okay, how do we use supplements as well as nutrition and so forth? But in this particular discussion today, to mitigate side effects, in the, realm of cancer therapies, how do we use supplements to maybe get a better effect out of a conventional therapy? Can we augment the overall outcome by combining both a conventional and a supplemental, source? Definitely some research leading there, and I think that's absolutely, fascinating. And I think it could be something that could be very valuable naturally for the cancer population. And of course, I'm going to always be looking at, can we improve energy and immune function and quality of life and sense of well-being, all with thinking, how does this impact one's overall outcome? With the idea of wanting, of course, to have a longer and healthier, overall outcome.
Yeah. And so what I think also is so important, and probably what is an underlying message with all of this, is it's really important to work with an expert, with a professional, and have these discussions, whether supplements are appropriate, which ones might be safe, will they be effective. So not starting to implement supplement use on one's own without really doing due diligence and having those important conversations with an expert.
And I really hope that that honestly goes both ways, because I do find some practitioners don't know. And so they put like their hand up and they're like, just don't use it. And I'm like, that is, as a practitioner, that is a worst thing we can do as a word, as a, just a disservice to our patients. And oftentimes you all are very well versed and know quite a bit too. And so, then I think we're more likely to have individuals go rogue and then just simply not communicate. And I think that increases the danger much more significantly than I'm really not sure. Let's figure that out together. So I'm always educating practitioners to please not just say no, take a deep breath first, and then decide, like, would this be something that we could consider, or who could we talk to, that would be able to better, help us. And one group that is amazing are your pharmacists. I have no specific connection with pharmacists, but I honestly find that they know the mechanisms, they know how the medications are working, they know the way that these supplements function. And they, if particularly in different kinds of cancer centers, I have found some to be very knowledgeable. And even with my background, and I will double, triple, quadruple check different things, but I may still be like, hey, Alan, what do you think about, turkey tail with Ibrance with this? Like, would that be safe? And so that we can kind of combine, different, situations. And sometimes it may be like, yes, that one would be, but not another, mushroom strain because of something. So, that's something that all patients and practitioners have access to in terms of those pharmacists. And they may or may not know, but they generally are going to likely honestly be intrigued because that's their wheelhouse, And so
Mhm.
how these different compounds are functioning, they can be a great ally to the practitioner and patient side so that we're kind of all one big team.
Yeah.
I love that.
Absolutely. And I think definitely maybe even an underutilized resource. And you kind of alluded to that too, is the pharmacists. And I do appreciate the sentiment that you mentioned about really this going both ways, right? And I think Erin can also speak to this as well too. But as dietitians, I think we get a lot of those secondary questions because maybe a provider kind of put that hand up and said no. So our team actually put together a list of kind of our most common supplement questions that we get. So we oftentimes hear about vitamin D, probiotics, calcium, turmeric, and collagen. Those were kind of our big top five. So that's what we're planning to hopefully dive into a little bit more today, with definitely some rapid fire fit in at the end as we're able to. But I would love to just start even with vitamin D. I think a nutrient that's so important to many. And I think one of the most common that we often hear our patients taking. And I'm just curious your perspective, how does somebody know that they need to take vitamin D, right? How do they know that this needs to be part of their routine?
Without you need to test it, that would be kind of the main thing. And the reality is, unless you're taking some vitamin D, you probably just need it. You're probably low, just because it is one that, yeah, while we do get some within sunlight, depending on kind of where we live and the sunlight and the UV rays and the latitude and so forth, generally our bodies will need more than we're just getting in within sunlight and or our food. Our food is definitely a minor source in this particular, nutrient. So there, I do think that testing is fantastic. A serum 25-OH or 25 hydroxy vitamin D is a simple test, generally included with insurance. We're not using it as a, diagnostic marker, but even just to have a clue of where things are. And some, may say, oh, well, I know I'm low, but knowing where you are, I really, for an oncology patient, really want to strive to kind of closer to a 60 nanogram per milliliter. A lot of the reference ranges are going to use 30 to 100. So somebody may say, oh, you're 32, you're normal. I'm like, it's technically normal, but I would say is that, we're not looking for to not be deficient. I want you to be optimal. So I would definitely want to know what that number is. And if I saw that hypothetically somebody's vitamin D was at 10, I would be like, okay, we may want to have a good 10,000 international units of D3 daily for a period of time and then retest. If they were at 45, we may only use 2,000. Or if they were already taking one, do we just add one or do they? But most of the time, I find 2 to 5,000 IU daily is generally a pretty good stable amount to kind of get people in that 40 to 60 range within their blood. D3 is more bioavailable than D2, so I do favor that from a supplementation perspective. And I would also say that I would like D3 to be combined with its sidekick, vitamin K2, because vitamin K2 will enhance the absorption of D3, and we could use K2 for a variety of other therapeutic properties as well. So kind of looking for that combination together. Um, is vitamin D going to prevent cancer? We don't have, research necessarily to suggest that per se. And I would say the research on incidence of cancer is a little bit weaker. There are some trials and meta-analysis of different randomized control trials that have shown that vitamin D supplementation can significantly reduce total cancer mortality, but maybe not incidence, per se. But where it does seem to be the case is if we have more optimal vitamin D levels, again, less, kind of a lower cancer mortality. And that's the case for a variety of different types of cancers. I'll just name a few just so that some people I know are like listening for their particular cancer. But definitely even in, beyond breast and gynecological, lung, prostate, kidney, melanoma, head and neck, maybe gastric, pancreatic, liver cancers, too. So there are definitely a variety of areas that could be, valuable. The one other thing I want to add before, I'm sure you've got another rapid fire question for me, but before I forget, is immunotherapy. And this, I think, is interesting because it seems that if we have a sufficient or really, I would say, optimal level of vitamin D, it allows your immunotherapy to work more effectively, the the immuno checkpoint inhibitors. So that's something that if you're on an immunotherapy, which is absolutely an area of treatment that is only growing, 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 and kind of growing exponentially, could be a thought. Now, we don't need to be some astronomical amount, but again, check those levels and see, am I at an optimal level? Because I may get a better effect from my immunotherapy drug by having optimal levels of vitamin D. So just a thought on that one too.
Yeah, that is such a great point. And I think really it all kind of boils down to, we really want to make sure we are checking those levels, right? Pre treatment, during treatment, post treatment to see kind of where we're falling. Are we in low optimal and like not deficient, or are we in those optimal levels? If somebody is sincerely low, and let's say maybe they are in active treatment, is it safe to take those very high therapeutic doses? What would be your 2 cents on that?
Is it safe? Yes. I mean, depending on how vulnerable and weakened a patient may be, I don't know that I would be like, let's do 50,000. You don't feel well at all. I'd probably be like, let's try 5,000 and just make sure. Generally, D3 is very well tolerated. But again, and you're in a very vulnerable population, I think, a little bit of water can be, we can have an adverse reaction too. So generally there, I would say like 5 before I'd probably doing like 50s. But I don't really think that if it's 5,000 shouldn't cause any kind of a challenge for somebody, a 5,000 IU, that would be international units. You could do 2, but I would say that 5 would be very safe and generally very well tolerated.
Okay, wonderful. And then in terms of this cancer journey, right? Should somebody start taking vitamin D, let's say they find out their levels are low initially, when they're getting their preliminary lab work done, is it safe to take all throughout treatment? Are there any indicators that would say maybe we should pause on vitamin D?
Vitamin D is one that you honestly could take 7 days a week. I don't really have any concern of a D3, from a treatment perspective, going to interact with something there, going to, lessen somebody's absorption of a nutrient or something other, compound. The only thing would be is if we're not ever checking and somebody's taking higher levels and then we check the vitamin D and it's like, oh, I'm at 150 and we're like, hold up. Now we do indeed want to hold that vitamin D because we don't want to have that level be too high. Again, my aim is 60, 40 is respectable. I'm okay up to 80. When you get above 80, you start making me a little nervous, and I'm going to start to want to have lesser dosages if we're getting in on that higher side. But unless the level's too high, unlike many other supplements, it is one that you could kind of take pretty much on a daily basis and not have a worry related to a immunotherapy, chemotherapy, radiation therapy challenge.
Great. It seems like vitamin D is something that many of us need, right? And it's generally really safe kind of all throughout treatment, which is so good to hear.
Indeed.
Absolutely. And you mentioned immunotherapy a couple times, Natalie, and this certainly makes me think of our next supplement to address, which is probiotics. And certainly for someone that's on immunotherapy, we're thinking about, what their immune response status looks like in general. But overall, when we think of probiotics, and if a person is interested in starting probiotics, is that a supplement that is safe to take during varying types of treatment, chemotherapy, radiation, and immunotherapy? Is there any indication that perhaps a person should pause or hold off if they're receiving one of these?
So, despite an early study, and now I can't remember how many years back it was, that showed some concern there, probiotics are generally considered safe to use with immunotherapy based on current, and again, this could change, but the current clinical and preclinical, evidence as of 2025. There have been multiple studies that have demonstrated that supplementation, particularly with strains of Lactobacillus and Bifidobacterium, which are the most common lactic acid bacteria-based probiotic, products that are out there, that it's possible could even enhance the efficacy of immune checkpoint inhibitors and improve overall survival. But in general, I do remember years back there being one study that kind of definitely did give us some pause. But at this point, I feel like the more trials have since been published saying, no, maybe that really wasn't the situation. Where do I generally pause probiotic usage? One, if somebody is particularly neutropenic. Now, many cancer patients are going to be on a myelosuppressive medication or treatment plan, or just, be myelosuppressed. And I do find that typically speaking, we can still utilize probiotics there. But if they're really neutropenic, then we just get a little bit nervous. Now, technically, a probiotic should be very clean and create no issues whatsoever. But because they're not regulated and proven safe before they're on the market, we kind of work reverse in the supplements. Once people complain about them, then they get investigated and get pulled off. But we can put things on the market before that's really, deemed officially, safe. So we have to kind of be cautious in that regard. So just because we can't guarantee that that probiotic is indeed completely clean and safe, we wouldn't want to create, sepsis or bacterial translocation in somebody who was particularly immunocompromised. So there I'm a little bit cautious. If there are bacterial overgrowth, bacterial yeast overgrowth issues,
Mhm.
it's not going to generally cause sepsis, but it may aggravate the system and kind of, not be the most helpful in that current moment. They may be essential down the road, but just not in that current moment. But overall, just a healthy individuals who's then embarking on immunotherapy, I think it could be done safely. Of course, we still want to be using quality um,
Mhm.
probiotics. And I think the biggest challenge of probiotics, quite honestly, is there are millions out there. So which one do we take? And I think that is, well, what are we taking it for? And so, sometimes I'll have patients, Natalie, what probiotics should I take? I'm like, well, are you taking it for UTI? Are you taking it for cholesterol? Are you taking it for your mood? Are you taking it to boost up GLP-1 production? Are we taking it because you have yeast overgrowth? Are you taking it because you have diarrhea? Are you taking it because you had C. diff? I'm going to give you a different product for all of those different scenarios that I just rattled off. So that I think is the challenge of, well, which of these hundreds of them at the market do I choose that's going to be best for me at this particular time? And best today could be different next month or last month. So that also, can complicate, the matter a little further. I like probiotics in the sense of it, facilitating proper digestion, absorption of nutrients. I like the fact that it's going to enhance that mucosal cell membrane so that this is my little fake mucosal or little illustration, I guess, of mucosal cell membrane, but we don't have leaky, holes in there that allow toxins and bugs and things to kind of get through. So we have that, and probiotics help us to kind of keep that, tighter. Then that is generally a very, favorable effect of probiotics. Um, so do I just always add a probiotic supplement? Honestly, I probably used them more 10 years ago than I do today. Because I feel like now there are just so many other options, and I may be like, before I just dive into the probiotic, I want to know more about which one should I recommend. And it may
Yeah.
take me a little bit more homework and a little bit more studying of what's happening for this individual, or where certain labs are. If I'm able, have they run a stool analysis? Like I just saw a stool report yesterday of a patient, and I was like, boom, clearly we want Akkermansia because it was very, very low. And so that made it really easy to choose which probiotic, do we really want to have. So I tend to kind of do some other gut healing things sometimes first these days, but I do always think about probiotics. Probiotics, of course, we can also get within our food sources. The question is, are we going to get a high enough kind of therapeutic value? But I'll
And
let
I'm
you
glad you,
there.
yeah,
Yes,
I'm
go
glad you
for
mentioned
it.
that question that came in on Facebook. I love that. So for this person, they're saying their neutrophils are low. So instead of taking a probiotic, they're drinking kombucha as sort of their probiotic supplement. So would that be an appropriate substitution given in this particular situation? Would they still be getting even a little bit of an active bacteria benefit?
Yeah, so if you're getting, I mean, if I think, yeah, if you're really, really low, again, hopefully would be safe, but just to be cautious, using a really good apple cider vinegar that's kind of, muddy on the bottom, if you will, using a, kefir or yogurt, or even a non-dairy kefir or yogurt that have those probiotics, a kombucha, just be careful of the sugar content,
Yeah,
miso or tempeh or natto, if fermented foods are there, are viable options. All of those could definitely be a source that may not be giving a lot, but it could at least be a little bit and should be very safe.
perfect. Thank you for that. And then just curious, one more question about probiotics. In terms of could it interfere with a cancer treatment? Is that scenario present for any particular treatment regimens or medications that a patient should be aware of?
Not one that I generally worry about from an overlap. And most oncologists, whether they're doing radiation, whether they're even, surgeons, sometimes we're going to pull different things the week prior, which I still would generally do. But even a probiotic, they may even be fine with keeping a probiotic in there.
Yeah.
But generally thinking through the various kinds of chemotherapy, other kinds of agents, immunotherapies, not one that typically I'm worried about unless, again, we're getting really low counts.
Got it. Wonderful. Thank you.
Wonderful. Moving on to another very common supplement that we get asked about, especially in our community with breast and ovarian and hormonal related cancers. We talk a lot about bone density and calcium. And so I'm curious, your perspective, somebody who's in medically induced menopause or experiencing bone density loss, would you say that calcium supplements are necessary in that state?
Possibly. Again, in a perfect world, and I know we don't live in one, but I like to, have those scenarios at least. I would love to be able to test somebody's intracellular level of calcium, which of course your typical panels, we're going to only get a serum value of calcium, which many are getting regularly tested, but that is going to always stay very, very stable. If your bones need it, we're going to take it from the bones and make sure that that serum calcium stays stable. So the blood calcium that we're generally seeing on various panels is not something we can use to assess our calcium status. But what I find is honestly, some do need some calcium supplementation, many don't. And so I oftentimes, again, if I can, I would like to test where their level is to determine, do we want to have that calcium, in there? Generally speaking, calcium supplementation should be safe, with the exception of our prostate cancer patients, which is one area I think you don't have to do too much in the Unite for Her kind of campaign. But these days we try to be very open, to all, everywhere we are. So that would be one possible concern there. But I would also say that calcium, in my humble opinion, kind of was like somehow got like, well, I think honestly it was the Got Milk campaign many years back, but it got like catapulted to the front of the pack. But calcium, I find absolutely a very crucial component for bone health. But equally important, I would argue, is D3 and K2 and magnesium and zinc and vitamin A, and copper, and kind of going on. So I think that yes, I want to look at calcium, but I really want to look at the entire bone nutrient matrix to determine what do you need so that we're not taking something unnecessarily. Um, if we are using calcium supplements, do you need to have the 1200 milligrams a day? I would argue no, probably not, because you're going to get hopefully a good amount, most of it, I hope, in your food. But we may then use 300 or 400 or 500 milligrams as a supplement to make sure you're hitting in that need if my bone density is low, or I was able to kind of assess my calcium and it's not the best, or I have this strong history. But I would say that just doing calcium and leaving D3, K2, mag, zinc, and so the rest in the dust, that is a disservice. We really kind of want, that entire kind of blend of those to really, I think, honestly, have the healthiest, strongest bone that we can.
Absolutely. And I think it's really about that bigger picture. And we talk about that a lot here at Unite for Her, right? It's not necessarily just one nutrient or one food. It's really about all of these complementary things that are going to work together. So, especially those food sources of calcium, they may have some of these other things you're mentioning, right? They might have vitamin D, they might have copper. If somebody did find they needed to take a calcium supplement, right? Just to get a little extra, maybe they assess that they're not taking in enough a day from food. Do you have a preference on types of calcium supplements? I know we've got carbonate, we've got citrate. Do you have any preferences there?
I would say X on the carbonate. Use that for like compost or something. It's the cheapest, which is bonus, but it's not very good for bone health. And it generally also tends to be constipating, which is typically not the direction most of us are aiming for. Um, Calcium citrate would be another kind of lower cost option that does have some decent bioavailability and also well tolerated. I also like some of the calcium hydroxyapatite. components as well, but those are going to go a little bit higher on a price range. Some of them, like their algal calcium, would be another one that some I do find do well with and tolerate, and seem to have some good research, there. But so the calcium citrate, calcium hydroxyapatite, algal calcium could be some decent options.
Great. And then one other thing in terms of calcium is that I know sometimes folks are struggling with particularly like calcium oxalate kidney stones, for example. With somebody with a history of kidney stones, because I know you mentioned prostate cancer, for example, is a time where we would want to be mindful of calcium. However, thinking about that, is somebody with a history of kidney stones, should they be worried about their calcium intake or supplementation?
I would say diet, less of an issue, but supplements, absolutely. We particularly if you know it's an oxalate-based stone, then calcium supplements generally are not considered to be safe at somebody who's had kidney stones because it could increase the risk of that stone formation, particularly if it's taken kind of, outside of meals. But I also would say that carbonate is more likely to create that problem than even these other types. Because again, the more bioavailable form that you get, the less likely. The whole point is not to lead to a little stone. We want it to go to our bones, right? But I would say that, yeah, if you've got a kidney stone oxalate challenge in the past, I would be cautious and try to do food sources and get the other bone building nutrients or use baby amounts, of calcium, or just make sure that's being very monitored, carefully before, throwing on that supplement there.
Perfect. Thank you.
Definitely.
Amazing. So, our next supplement we wanted to hit on, this is a biggie in the cancer space. And I certainly learned a lot from listening to you in your talk earlier this year. Let's jump into turmeric or curcumin as that active ingredient. So, first and foremost, is it safe to take, again, with varying types of cancer treatment, chemotherapy, hormone therapy, even targeted therapies? Is that a supplement that could be used across the board?
Unfortunately not, but there are many nuances to it. Generally, it could have a blood thinning effect, so it is one that generally is going to be stopped prior or, a week prior to surgery. Because it's an antioxidant, you're going to find most radiation oncologists a little nervous to use, curcumin, with radiation, there. So maybe we'll learn more, but generally I feel like there's going to be some caution, there. What about chemotherapy? What's interesting here is that yes, it is an antioxidant, so there's that whole, kind of challenge in terms of well, does it help or does it negate the benefits of my treatment? And there are studies to look at how it can reduce the toxicities of different kinds of chemotherapies, and it may kind of improve that myelosuppression that we may have from chemotherapy, so we're not quite as low in the counts. It may be better in terms of neurotoxicities if we have curcumin, and there may even have better gastrointestinal issues or less GI toxicity, I should say, less even heart toxicity from, certain medications that are hard on the heart and even those that are hard on kidneys. The challenge is just generally saying curcumin, it just is one we have to be very careful with because it is, despite generally pretty well tolerated, it's not known to have the best bioavailability. And most of the cancer trials use a pretty substantial amount, typically 4 to 8 grams amount. Think of most supplements are about 500 milligrams a capsule.
Wow.
So you're talking not just one or two, you're talking a handful, there. And if we're just using, turmeric in food, amazing, but you're probably going to have to use multiple tablespoons a day
Right.
to really get that effect. So I love that idea, and I definitely still have my fair source of turmeric in my foods and beverages. But I think the challenges in terms of kind of what is the safety with certain treatments. Um, there are different ways that curcumin is formulated. So your initial formulations where it was, touted to have with piperine, which is the phytochemical in black pepper, that does enhance the bioavailability of turmeric. But those first generation formulations are generally going to impact and go through that CYP liver process and are going to be contraindicated in medications that are kind of along that CYP pathway.
Mm. Hmm.
Um, so if we're going a second or preferably even a third generation formula. And then, and like third generations are like Longvitas, Curcufens, which are a little less popular, but they're coming, I think, more, less trials, but they do have greater bioavailability and absorption. So you can use one or two capsules rather than 10, 20 capsules. The second generations, I'm just saying a few general things because somebody may be like looking at their own bottle. Mariva, Theracumin, those are a couple types that are kind of considered that second generation formulation. Those are like a phospholipid base that bypasses hepatic first pass, the liver. And therefore, it avoids maybe all, but certainly the majority of the CYP mediated interactions, which is typically the reason why somebody says you can't use curcumin with this particular treatment. So there I would say we want to definitely be cautious, but if we use the right type, it may be safe to use. If you know you have a treatment that really is hitting you hard symptom-wise, what I oftentimes will do is hold curcumin with certain chemos, day of treatment, couple days after treatment, essentially the half-life of that medication, even I safely multiply it out by 5, and then determine when can we add it back in.
Mm.
That gets a little bit more complicated if somebody's on a weekly chemo versus every other week or every 3 weeks or every 4 weeks. But that is definitely another avenue that you can kind of use to make sure that it wouldn't impact your treatment negatively. But this is a tricky one. We could spend 8 hours just on curcumin.
I know it. I know it. And right, there's so much inquiry about it. But I think what you're saying is, it definitely has some healthful benefits, but there's nuance to it. And again, leading back to what we were saying earlier, it's why it's really important to work with someone to understand whether you're going to a pharmacist, whether you're working with a registered dietitian that can help you along to make sure if it's part of your regimen, it's used timely, appropriately in doses that may work and not having that interaction. So really that team effort is so important.
Indeed.
Okay. And I know that we're going to share the link to your website and you've got so much good information on there. So I know we've got just a few more minutes. We've got one more supplement I want to make sure we hit before we wrap this afternoon, but there's so much more information on your website. So for those that want to dive a little bit deeper, let's put that in the chat and Facebook so our audience can do a little bit more reading and inquiry themselves.
Absolutely. And we even got some audience questions on this last supplement. So I think very fitting to kind of wrap with it. But collagen, I feel like it is kind of all the rage these days. I see collagen supplements everywhere. Is collagen safe for cancer survivors or does it promote cancer cell growth?
Excellent question. And years back, I brought this to our UCSF Cancer Center team. I started talking also with some of the medical oncologists that were more integrative. And initially, I remember one of the oncologists said, well, why would it be? I'm like, well, just think theoretically what is happening. And I love the fact that yes, it can help our hair, skin, nails, but anything that improves growth, when we're talking oncology, that is going to make us pause and be a little bit nervous. Do we have human data to show that collagen supplementation is increasing the risk of cancer? I would say at this current time, no, we do not. What are we thinking from a mechanistic perspective is, unfortunately, I think that collagen may promote cancer cell growth in that tumor microenvironment because of the way that collagen is that, major component of the extracellular matrix and its abundance and remodeling, in tumors facilitates cancer cell proliferation, invasion, metastasis therapy, kind of resistance. So I do use collagen in oncology at times. I do find that, bottom line, if somebody cannot tolerate any kind of protein, collagen is going to be the best bet. So if you really don't feel, but you've got to get protein in, use collagen to get the protein in because just being malnourished and cachectic and weak, that's not going to help you either. And then if you're in more of a remission situation or you're doing better, I would say use collagen cautiously. And what I really am interested in too is could we use 5 grams a day to get the benefit of hair, skin, nails, maybe bones, but not get negative effects? Maybe, we don't know yet. But it does make me nervous on a day-to-day basis to be getting 20 or plus grams of collagen within the cancer world because there could be a contraindication there. As much as I, love collagen and, use it in different scenarios, it does make me a little bit nervous, unfortunately.
Okay. Yeah, it seems like the jury's out still a little bit in terms of collagen. And I think we can say that about a lot of things is that maybe more research needs to be done. But I like your point of, I wonder if we can do it in lower doses and maybe that's more effective in terms of no risk associated, but the positive benefits are still there.
Indeed.
Wonderful. Well, Erin, are there any other questions that you feel like stood out you want to wrap with rapid fire? Because I know we are getting quite to the end of our time today.
I think one thing that came up, and even in fact in consults that I had yesterday, was also quickly creatine is coming up quite a bit in terms of supplementation. Is there a benefit? Is that safe, generally speaking, for use in the oncology population? Is there a setting when that may be helpful? And maybe we'll wrap with that as our last question.
Okay. Um, right now, the research on creatine looks safe for the cancer population. And again, that we may find with research that shifts to some extent, but right now it does look to be safe. Are we using creatine these days for the most part for bodybuilding and sprinting and so forth? No. I mean, I think what's kind of cool is the largest population, I think, at study of creatine right now are postmenopausal women. Like, yes, that's fantastic. But I think there is more of like, does it help with muscle recovery? I think research is pretty clear that yes, it can be very beneficial as there. I think the two other areas that are intriguing, we need more research, but I think look promising are could creatine help with bone mineral density?
Mhm.
Possibly, we think so, hopefully. And then the other area that women are like, really? I love it is can it help with our cognition? It's not going to change our IQ, but can it help our synapses to be a little bit more, efficient and snappy? That there does seem to be some improvement in cognitive benefits from creatine supplementation as well. So, as of right now, I feel like that's one I feel more comfortable with using within the oncology population and could absolutely be incorporated, even like a five, most of the research uses 5 to 10 grams on a daily basis. You could do a loading thing depending again on where somebody is. I may just kind of skip the loading thing and go slow and steady, 5 to 10 grams a day powder.
Mhm.
So you're not taking handfuls of capsules.
Mhm. I love that. Thank you. Yes, we could talk to you all day,
You can
and
come back
I'm
for
sure
part
our
two. I
Unite
know there
for
were other questions we didn't get to, so I'm
that's
sorry for
okay.
those that didn't get their questions answered. But yeah, like I don't know what your all situation is, but I'm happy to try to come back for part two of just rapid fire, audience questions too.
We would love that. I'm sure our community would love that. So we may hold you to it, Natalie. But for
Okay.
the time being, we are so thankful for you being here with us. This was a fabulous Ask the Experts today. Truly, you are a real expert, and you're just giving us so much to think about and looking at supplements in a way that can really help alongside. But of course, appreciate the notion of working with a professional, looking at food sources as well, and finding that balance of the two. So we appreciate your time and thank you for being here.
Thank you very much for all attending, and thank you for all that you all do, to help everyone else out there in the cancer world. So
Oh,
this is love both directions. So thank you.
absolutely. You're welcome. We're in it together.
Yes,
Absolutely.
absolutely. Absolutely. And of course, thank you to all of our sponsors today. So, as a reminder, our UFH Connect is presented by West, Merck, Lilly, Novartis, and Gilead Sciences with support from gold sponsors Pfizer, GSK, and Daiichi Sankyo, and supporting sponsors AbbVie, Tercera Therapeutics, and Verastem Oncology.
Amazing. And again, our segment today was recorded, so you can visit uniteforher.org/UFH Connect to view the recording. And hopefully, I will see many of you tonight for our speaker series focused all on cardiorespiratory fitness and cancer. We heard a little bit about medications being potentially cardiotoxic, so we'll be diving in to how fitness and cardiac, working with a physical therapy expert, can help perhaps mitigate some of those long-term heart effects. So more discussion to be had, but for the time being, Aubrey, thanks so much for being here. I love hanging out with a whole bunch of dietitians, so it's so great to spend the afternoon together.
Of course, yes. And we are definitely looking forward to maybe a round two in the future, Natalie.
All right, sounds
Love
good.
that.
Take care, everyone.
Take care. Thank you.